In this video, I am going to review a representation of your films and describe your surgery in detail. I will go over all the postoperative care instructions and discuss treatment options that you could consider other than surgery. Lastly, we will go over all the risks and benefits of surgery, and I will hopefully answer any remaining questions that you may have had. Again, I want this video to be a recreation of your office visit and to be used as a reference guide for you, your family, and your friends. This is an MRI of the lower back. We're looking in from a side view, so to get you oriented, this would be the front of the abdomen, this would be the outside of the back, this here would be the tailbone. The bones are numbered, so this would be the 5th lumbar vertebra, the 4th lumbar vertebra, the 3rd, 2nd, and 1st lumbar vertebra. In between the bones are these dark oval spaces, which are the disc. In addition, you can see this white stuff here. That's spinal fluid in the spinal canal, and the little stripes that you see are the nerve rootlets that run within the spinal canal. So again, we're looking in from the side. This would be the front, this would be the back, and this is the tailbone. Now you can see between the 4th and 5th bone, there's a herniated disc, which is represented by this dark structure here. And the herniated disc has herniated backwards into the spinal canal and is pinching the nerve. So this is a good example of a herniated disc between the 4th and 5th bone of the lumbar spine. This is another view of the spine I'd like to show you. This is a view looking straight down the center of the spinal canal. So to get you oriented, this would be the front, this would be the outside of the back. The right side of the picture is the left side of the body, and the left side of the picture is the right side of the body. Again, we're looking straight down the center of the spinal canal. This oval white structure is the spinal canal itself, filled with spinal fluid. And then there's an area where the nerve goes out. So you can see this gray structure here is a nerve, and this gray structure here is a nerve. The nerve goes out through a space between the edge of the disc, which is this point right here. This dark line represents the edge of the disc, and this dark border right here is the edge of your joint. So between the edge of the disc and the edge of the joint, there's an opening or space where the nerve goes out. And at this level, you can see how nice and big and open these spaces are for the nerves to go out. So this would be a normal looking level of the lumbar spine. Now these are the slices of the lower back looking at the level where the herniated disc is. So if you look here on this particular slice, you can see there's a broad disc herniation represented by this dark material that's pushing into the spinal canal and also narrowing the space and pinching the nerves as they go out through their openings. And you can see the disc is more off to this side of the picture, which is the left side of your body. If you come to the other slice just below that one, you can see the herniated disc right here, and that's a piece of disc material that has come out of the disc space and gone downward and tucked itself down under the nerve, pinching the nerve on this side, which again is the left. So most people who come in with a herniated disc with a pinched nerve, typically they'll present with symptoms with back pain, maybe pain or numbness into the butt, hip, or down the leg. And then what happens at surgery is we perform a laminectomy. So again, this is the lamina bone right here. I would take a portion of this bone off the back of the spine, which gives me access to where the disc is. And then what I can do is I gently move the nerve so I can see the disc, and then I trim that portion of the disc off that's pinching the nerve. So I would actually take that piece of disc right out, and that would unpinch your nerve and help with the symptoms that you're having. It's not unsimilar to having a stone or pebble under your foot in your shoe. So if you're walking around with a stone or a pebble under your foot in your shoe, it hurts. If you get in there and take that pebble or stone out, your foot feels better. It's very similar. By getting in there and taking that portion of the disc out and trimming it off, that will unpinch the nerve and help with your symptoms. So if we come back to the next image from the side view, what I would actually do at surgery is I would trim this portion of the disc off, and by doing that, that would unpinch the nerve and help with your symptoms. So this may be representative of an MRI that you saw in the office, which represents a herniated disc. This is a model of the spine looking in from the back side. So we're looking at a model of the lower back. When you look at it, you can see these protrusions, which are the bone over the back of your spine. These structures I'm pointing at are called spinous process. When you feel your back and you push on the middle of your back and you feel those firm bumps, those are the spinous processes, which are these bones I'm pointing out right here. Attached to the spinous process is called lamina. So when you hear of people having a laminectomy, it's this bone that's being resected right here. And then next to the lamina are the joints of the spine called the facet joints. So this is the spinous process, these are the lamina, and then this is the joint called the facet joint. So when you have a laminectomy for a herniated disc or a pinched nerve, what I'm doing is I'm resecting a portion of the lamina bone, and that is called a laminectomy. By resecting this bone, that's helping to unpinch the nerve, but also giving me access to the disc if I need to resect a herniated disc. So for your surgery, I'm performing a laminectomy by taking a portion of the lamina bone out. That helps to unpinch the nerve and also gives me access to where the disc is in case I need to trim some of the disc off. Patients undergoing this type of surgery will either go home the same day or stay overnight. We will often make this decision together on the day of surgery. If you do go home the same day, I will discuss discharge instructions in detail with you and your family. This will include things such as wound care and dressing changes, activity after surgery, and follow-up instructions. If you do spend the night, then I will see you in the morning and we will go over these same discharge instructions at that time. I am including these instructions in this video for you to use as a reference guide.
First, let's talk about wound care. Your incision will be closed with either dissolvable stitches or staples, which we will let you know before you leave the hospital. At surgery, I will cover your incision with a sterile bandage, which is impregnated with antibiotics. Often I will place another white bandage above or below that bandage. These bandages will remain in place for 5 days after your surgery. So for instance, if your surgery was performed on a Tuesday, you would not remove your bandages until Saturday afternoon. Or if your surgery was performed on a Thursday, you would not remove your bandages until Monday afternoon. I want you to keep your bandages dry until they are removed on the 5th day. So I would like you to perform body baths until that time. On the 5th day after surgery, you will take your normal shower and then remove your bandages. After that point, you do not have to keep it covered or cover your incision anymore. So there are no bandage changes that you will have to perform after your surgery. If you do have staples, then you will need to call my office to schedule an appointment for 2 weeks after surgery to have the staples removed. Of special note, patients can often experience a small amount of drainage from their incision for up to 1 week after surgery. This is not unusual, and we ask you to keep your incision covered for the time period while this is occurring. If you experience a fever greater than 101 degrees Fahrenheit, chills, excessive redness, or breakdown of your incision and/or excessive drainage from your incision, including the presence of pus, please contact our office at that time. Again, it is normal to have a slight degree of drainage occurring on your dressing, but this drainage should not be excessive and should not saturate your dressing.
Now, let's discuss activity after surgery. I would ask that you keep your lifting light. I would like you to lift no more than 5 to 10 pounds for the first month after surgery. Just think about a gallon of milk weight-wise as a good guide and try to keep your lifting no more than that. You may be up walking around the house and go up and down stairs several times a day. If you feel up to it after several days, you could even go out to dinner or go to the grocery store for short periods. Walks no more than 30 minutes would be fine. If you drop something, you can certainly bend down slowly and pick it up, but I would try to avoid excessive bending. When you get to the point where your muscles start to ache or you feel fatigued and tired, you should sit down and rest. The first month after surgery, you will feel tired and maybe even exhausted. Most people certainly feel this way. Your back should feel sore. In addition, you will most likely experience a degree of discomfort remaining in your buttock, hips, and lower extremities. The intensity varies from patient to patient. Overall, the majority of patients will continue to feel tired and sore for the first month after surgery, so please expect it. Things I would like you to avoid for the first month after surgery would be primarily heavy lifting and excessive bending. Remember, I would like you to lift no more than a gallon of milk weight-wise. I don't want you to formally exercise this month. The first month should be a time for you to take it easy and keep your activities light. Your body definitely needs time to recover. I would ask you to wait at least 2 weeks after surgery before getting back to driving. This is primarily because of pain and the use of pain medication. You shouldn't drive while taking pain medication. Another important thing to remember is your symptoms that you had before surgery, particularly in your buttock, hips, and lower extremities, can fluctuate the first 2 to 4 weeks after surgery. For all of these reasons, it isn't safe to drive for the first several weeks after surgery. You will be provided with pain medication and a muscle relaxant to go home with after surgery. Typically, I like to use Percocet or Norco for pain and Xanaflex as a muscle relaxant. Pain medication can often cause constipation, so I would recommend using an over-the-counter stool softener such as Colace or Pericolase. These medications can be purchased at your local drugstore and can help prevent constipation. I also recommend that you drink plenty of water after surgery to keep yourself well hydrated. All of these measures will help to prevent constipation. After your surgery, you will have several follow-up visits to my office. Your initial visit is typically at 1 month after surgery. At this visit, we will discuss increasing your activity. You can start light exercises, including light workouts such as working out an elliptical machine, treadmill, Stairmaster, or even a stationary bike. Light yoga, light stretching, and lifting of light free weights no more than 30 pounds would be fine. You can begin light housework, including pushing a sweeper or mopping the floor for up to maybe 15 to 30 minutes. Light laundry and cooking is fine. It would be fine to do light gardening outside or mow the grass for say 15 minutes. In the fall, you could rake the leaves, and in the winter, even shovel very light snow for 10 to 15 minutes. Walking is fine, but not to exhaustion. I would avoid jogging for at least another 2 to 4 weeks at this point in time. The most important thing after surgery is giving your body time to heal. If you do too much activity too soon, you could strain your muscles and cause yourself undue increased pain. The need for physical therapy will be determined based upon how you are feeling at your 1 month visit. Some people require physical therapy and others don't. If you do undergo physical therapy, I typically include a 6-week course consisting both of water therapy in a warm pool and the other half land-based therapy. Additionally, we will check your incision to make sure you are healing properly. And lastly, I will answer any remaining questions that you have regarding your surgery. The first month after surgery is very tiring and you need to expect it. You will be worn out and maybe even exhausted. You won't have your normal energy levels, and that's perfectly normal during this time period. You typically will have a second post-operative visit to my office 3 months after your surgery. If you are doing well at this visit, I would release you back to near normal activity. Activities such as golf, tennis, jogging, biking, and even riding a motorcycle are all examples of activities that you could start now. However, I may hold restrictions for a bit longer for people who engage in aggressive activities such as long-distance running, vigorous exercise programs like P90X, or activities that involve heavy lifting. At your 3-month visit, I will re-examine you, including checking your incision, and I will answer any remaining questions you may have. On occasion, you may require a 3rd visit if you are having problems or you need additional x-rays for some reason. Typically, I will see you back 6 months after surgery for this extra visit. If we did discuss treatment options other than surgery, these may have included things such as physical therapy, including water and land-based therapy. We may have talked about working with a chiropractor, massage therapy, acupuncture, traction, and treatment through pain management, including the option of steroid injections. Although these non-surgical options are available, they are usually not long-term solutions when you have pain or symptoms due to a pinched nerve or a pinched spinal cord. As with any surgery, there are risks. We talked about many of these risks during the office visit. Typical risks for your lower back surgery would include things such as bleeding, infection, nerve injury, permanent weakness, paralysis, no change or worsening of your symptoms, recurrence of symptoms requiring further surgery. There could be an injury to a blood vessel requiring a blood transfusion. Other risks of lower back surgery could include things such as bowel or bladder dysfunction, or a spinal fluid leak requiring repair. There's also a risk of anesthesia, a risk of a heart attack, risk of blood clot formation, there's a risk of pneumonia, and there's always a small risk of death. I realize that this list may seem very daunting to you, but I have performed thousands and thousands of spine surgeries over the past 20 years, and so I feel comfortable in telling you that I think you will do well from your surgery. But I can never say 100% there couldn't be a complication. That's a part of having surgery, and there's always that small risk.